Hello, students. Welcome back. American Public University, APU. Dr. D, welcome back. HCAD 301. Wow, we're on week two already. Time sure flies when you are having fun researching, writing, and investigating healthcare policy and decision making issues. We're on week two now, where we're actually going to look at access to care and health insurance. And as you may know from personal experience, insurance is the mechanism that will help spread the risk across the entire health system. So, in some cases, it reduces the risk from the provider's perspective, excuse me, from the payer's perspective, but it increases the risk from the provider perspective. So, when we talk about insurance, we're talking about moving the risk. The patient moves the risk to the insurer slash payer by purchasing the plan and paying the premiums. And then the insurer transfers the risk to the provider by establishing either a capitation agreement or some type of contractual carve outs or contractual agreements to deliver care to the patients. So while we use the term health insurance, most people are covered under a health plan. These plans have defined benefits, they have specific cost, and they often include out of pocket expenses like deductibles and copayments. I think the majority of uh, health plans or the population that are on health plans are really employer provided health plans. While there are public health plans such as Medicare, Medicaid, and other government sponsored health plans as well, very small percentage when you look at the number of people that are on private health plans, which are sponsored by employers. And then, of course, there are health plans that can be purchased off the health information exchange as well. So, here in week two, you're going to identify key policies and procedures within the U.S. healthcare delivery system, as well as examining principles for planning, managing, and evaluating those policies. Regarding the reading for week two, we're still primarily in those textbooks. So, in the textbook for U.S. excuse me, the United States Healthcare Delivery System. I want you to read Chapter 2, The History and Development of the U.S. Healthcare System. And then in your other textbook, Healthcare in the United States, you want to actually read Chapter 9. And Chapter 9 goes into health insurance. And there are a couple of attachments that I want you to also click on. So when you click on your reading and resources under week two, you're going to see probably about 4 or 5 bullet points. So two of them will be for the book, and then the other two artifacts are health insurance plans and network types, and then health insurance coverage in the United States in 2001. Excuse me, in 2021. Again, the lectures are embedded in the course as well as the chapter overviews for both reading assignments. Now, you're going to see a PowerPoint for chapter 9, but I don't want you to substitute the PowerPoint for the reading. So please do the reading, and then you'll use the PowerPoint to just supplement and reinforce what you read. Regarding the uh, assignment deliverables here. You have your discussion board in week two. And in week two, you're really going to select the type of insurance or insurance network, and you're going to describe it, and you're going to describe how it impacts the access to care and how it can be improved. So you can look at HMOs, PPOs, POSs, EPOs, out of pocket, all of the acronyms there, but you'll pick one and you'll describe it. You'll talk about the impact to access and how access can be improved, excuse me. Now remember, we're in a scholarly environment here, right? You're already reading two chapters or one chapter in two different textbooks, and you've got two additional artifacts that will help you with content. And I'm saying all of that to say the expectation is that you'll have in-text citation support from peer review references or other credible references in your discussion board posting and also in your assignments. Uh, and you can feel free to use the resources that you're already reading. You don't have to go outside to find any articles or any support. You're already reading the articles, you're already reading the textbook chapters. Why not just go ahead and incorporate those into your discussion board postings and your critical thinking assignments? Speaking of critical thinking assignments, your first assignment, planning, managing, and evaluating healthcare policies and programs, will be due this week. It's actually due on the 19th. And for this assignment, you're actually going to create a PowerPoint presentation that identifies and explores four key policy programs or initiatives that led to healthcare reform in the United States. And specifically, you want to identify by name and describe each of the four policies slash initiatives and their impact to healthcare reform. And if I were to rephrase that first paragraph there, I would say what are four key factors or four key initiatives that ultimately led to the passage of healthcare reform here in the United States. Your PowerPoint should be at least 5 to 6 slides. That does not include your title slide or your reference slide. You must integrate 3 to 5 scholarly peer review sources that have been published since 2019 or later. Please make sure you've got robust speaker notes. I'm going to look very closely for your speaker notes, meaning that potentially on these 5 or 6 slides, you may have very limited content on the face of the slides themselves because most of the rigor will be in your speaker notes. That includes the in-text citations. So you should have very robust speaker notes. If you do use borrowed content or paraphrase content on the face of the slide, please make sure that you are giving credit to where credit is due. Same thing with the images. There's no expectations that you'll bring in outside images, but if you do bring in images from the World Wide Web, then you must make sure that you're giving credit for those images as well. Even if those images have already been vetted for public use, you still need to give credit to where you got that image from. Okay. And then finally, here in week two, you do have a quiz. Looks like this one is only 9 points. So the week two quiz is only 9 points. Looks like it will be 9 questions. Okay, that's it for week two. Remember, office hours Monday through Friday, 7 a.m. to 7 p.m. Pacific by appointment. Reach out to me if you need me. You can also email me with your questions, comments, or concerns, and I'm happy to return them or respond to them within no later than 24 to 48 hours, but it'll usually be within the same day. Okay. Good luck here in week two, and I look forward to participating with you in the discussion board postings, reading your and grading your critical thinking assignments, and monitoring the progress of your quiz. Bye for now.